High-risk obstetricians, we really use ultrasound as our window into the pregnancy. So anytime a patient comes into our office, you're met by a really friendly, amazing front office staff. We have sonographers that are highly trained and specialized in specifically looking at pregnancies that might have something a little unusual or different about them, or the moms themselves have some medical conditions that do put the pregnancy at a higher risk. So also some patients that do come to us come for a screening ultrasound to make sure that there are no other issues going on in the pregnancy that we need to chat about, but otherwise it's to just make sure everything is continuing to go well. Then we meet with a patient and we go over any of those issues that are either going on with the pregnancy, with the baby, and or with the mom and her health. And we come up with a plan and work really closely with their OBGYN team to make sure they have a nice plan in place for the rest of the pregnancy. I definitely am walking patients through some of the more difficult times of their life. Having a family and creating a family looks different for everybody, and being able to sit down and go through what their concerns are, explain how we can make and optimize a pregnancy that might be very difficult for a particular family, and then walking them through that pregnancy, and then also whether they write a card or whether they come back and show me their pregnancy or their baby, or even if they've had a loss, how we can attack and come up with a really great plan for the next pregnancy. I really know that I'm a part of their lives and that we work really close together and develop friendships that really change who I am as well, working with families that really need our services. We have seen families through many different walks of life, and I myself have been a high-risk patient, and I think that really helps to relate a lot with patients. So in my second pregnancy, my daughter had a complex congenital heart defect, so I walked through that pregnancy and some of my own maternal complications as well. Really helped me understand what bed rest is like, what being in the hospital long-term feels like, also watching a child go through some major surgery. Also, my third child was born at 29 weeks, so I've also walked the journey of being a NICU mom, you could be in medicine all your life, you could even work in the NICU yourself, and until you're a NICU mom, it's really its own experience. And so I can really relate to patients that way and bring those fresh eyes sometimes to that experience. My name is Dr. Lisa Thiel. I'm a perinatologist at Spectrum Health Medical Group, and we are the maternal fetal medicine specialists at Spectrum.